Notice, the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients. Thank you. Nightmare disorder, also known as dream anxiety disorder, is a sleep disorder characterized by frequent and intense nightmares that cause significant distress or impairment in social, occupational, or other important areas of functioning. Unlike occasional bad dreams that most people experience, those with nightmare disorder have them repeatedly, often leading to fear of going to sleep, sleep avoidance, and even daytime anxiety. The content of these nightmares is usually related to threats to survival, security, or physical integrity, and they are more vivid, disturbing, and easier to recall than typical dreams. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, categorizes nightmare disorder under sleep-wake disorders. It differentiates between nightmares, which are vivid and disturbing dreams that usually awaken the sleeper, and night terrors, which involve episodes of screaming, intense fear, and flailing while still asleep with no detailed dream recalled. The causes of nightmare disorder are multifaceted and can include psychological stressors, trauma, substance abuse, certain medications, as well as other mental health disorders such as depression and anxiety. It is also observed that there might be a genetic component, as the disorder can run in families. Diagnosis of nightmare disorder is primarily clinical, based on the patient's history of recurrent nightmares and the impact of these nightmares on their waking life. A detailed sleep history, possibly including a sleep diary or polysomnography, sleep study, may be recommended to rule out other sleep disorders. Treatment for nightmare disorder varies depending on its underlying cause, but often includes psychological therapies, such as imagery rehearsal therapy, IRT, cognitive behavioral therapy, CBT, and sometimes medications. IRT is a particularly effective treatment where patients are taught to reimagine their nightmares with positive outcomes, rehearsing the new dream scenario while awake, thereby reducing the frequency and severity of nightmares. In some cases, medications have been used to treat nightmares related to PTSD. Educational and support measures are also important in managing nightmare disorder. Patients are often encouraged to maintain a regular sleep schedule, create a relaxing bedtime routine, and avoid sleep disruptors like caffeine and screen time before bed. Support groups and counseling can also provide additional coping strategies and emotional support. Overall, while nightmare disorder can significantly impact an individual's quality of life, with proper diagnosis and a comprehensive treatment plan, many people can manage or overcome the condition, leading to improved sleep quality and well-being.